Hi, good morning. My name is Anthony and I'm a respiratory care student from the respiratory care department. So before I would start, can I move beside you and I will check your ID band for patient information and at the same time I will assess you. Okay, so now that I'm done checking the patient's ID band for confirmation and assessment, so I'm going to introduce this one. So I explain what I'm going to do. So the doctor ordered you, by the way, to have you administered via oxygen. So this one is, you will identify this based on its color, which is color green, and also there's a label, there's a sticker being put up. So I'm going to explain to you some of the safety measures. So I already put up a signage outside, which is a no smoking sign, because oxygen being exposed to smoke, it will reheat, it will lead to bursting of the oxygen because it's exposed to too much heat. And also I have here being put up in a rack because it is one of the safety measures to it, to prevent from oxygen being accidentally tip off. And also I have here a safety cap, so that if later on, if you're no longer in use, you have to put the oxygen in a safety cap. And I think I'm good. So now that I already explained to the patient, I'm going to crack the cylinder first. So I think you will notice some little bit noise, but I just have to do this to get rid of any debris. Now that I'm done cracking the cylinder, I have here a regulator. So this one is a PISS. So before putting this one up, I have to check the O-ring if it's still in good condition to prevent from any leaks, and also for these two pins if there will be any malfunctions to it. And then I think it's in good condition, so it's ready to use. So make sure that it's being inserted correctly and it should be secured tightly. Just twist this one up, and then with this one we have to turn this until we notice the arrow to go up, so the maximum is in 1000. So by the way, Mr. Phillips, for you to know, this one would to how long will it last, so we have to times it with a factor of 0.28, and because the flow that was ordered is 2, we have to divide it at 2 liters. And then prior to putting the oxygen device, we have to set the flow first, especially with the order of 2, and then we have to fill it with our fingers if there are air coming out prior to inserting the device, such as nasal cannula. So we are going to put the device to the patient. So now the patient is no longer in use, we have to remove the device and then put it in this clean container, then turn this one off first, and then we have to assess again the patient, take up another vital signs, and then make sure the patient is comfortable. And then once the patient is okay with it, we have to make sure that we're going to turn this one off, twist this one up, and then make sure we're gonna set the flow with the highest to make sure that the regulator is back to 0. So I also forgot to mention it to you, by the way, Mr. Phillips, is that if we notice the gauge to reach about 500, please notify us immediately, so that we can immediately replace the auto tank with a new one. If not, you can notify the nurse station. And then please, by the way, prevent any children from playing near the auto tank. And then once we're gonna set this flow back to 0, we have to remove the regulator. Then make sure that you're gonna put this one in a safe place to prevent from falling down, and then put back the wrench, or if possible we have to cover it with a safety cap. And then make sure that you're gonna put this one in a safe place on the side. And then once we're done assessing the patient, we're gonna wash our hands, and then we're gonna document everything, and I think that's all.